Hello, my name is Meet. I'm one of the FMP student, and today we're gonna do HEET, which is head, ear, nose, throat, and neck examination. I'm gonna make a YouTube video for my professor. Will you give a consent to make a video?
Yes.
Thank you. And wash my hand. The hand hygiene is done. I'm going to explain the patient what I'm going to do today. I'm going to start with the head examination, and first is for the inspection. So I'm going to look at the patient head and inspect that.
Okay.
Patient head, it's symmetrical, no contour. There is no cut, wound. I don't see anything. The hairs are formed pretty good. Now I'm going to touch the patient head. Can I have permission to touch your head?
Yes.
Okay, I'm going to palpate the patient head for looking for any kind of swelling, bulging, or any hematoma, or any kind of wound or the skin rash. Patient head looks good. I can even palpate the occipital. And any pain when I'm doing this, sir? No pain. So the head examination is done. We'll move on to the eye examination. The same thing will start with the inspection. We'll look at the patient eye. The eye is well formed, symmetrical. Eyebrows are well formed. There is no drooping of eyes or ptosis. And we're going to look at the patient inside the eye observation, and we put the eyelid down, look at it, it's a pink, conjunctiva is white, no discoloration, sclera is white, there is no yellow coloration, so the patient doesn't even have a jaundice. Once we're done with that, we'll check the patient optic nerve tube by using the Snellen chart, by asking patient to get 6 feet away from the patient and asking patient to tell us which line they can able to read. We can close your right eye. Good.
Last one.
Whichever you can able to read.
L T F P H.
Okay. LTFPH, correct. And we'll do the same thing in other eye.
H F P T L.
Okay. Patient say LTFPH. Okay. And can you open your both eyes and can you read it?
L T F P H.
Okay. So patient able to read both things at the 6 feet, which is 20/20 vision. And what we do that we can use we'll use our pen light to look at the patient eyes for any kind of abnormality or the foreign body. So I'm just going to check the patient eye for any kind of things. Patient eye looks clear. I don't see any abnormality, no drainage, sclera, even the lens is clean. I can see the lens and sclera too. So we'll check patient's optic nerve too by doing two different tests. One is we can do first test we'll do is direct consensual test. In that, what I'm going to do is I'm going to flash the light from outer side to inside and check the patient pupil reaction. And the same time we'll do twice that test. So it's checking on the left, putting the light on the left eye. We'll see the right eye also react as equally. So let's do that. I'm going to flash the light. Okay. Good, it's reactive. I'm going to do again and check on the other eye. You look at my nose here. Perfect. It's constrict in the right eye, also constrict. We'll do the same thing on the right eye to check on the left eye. You look at right here. The left eye is constrict. Bring your and right eye constrict with the left eye constrict too. So direct consensual test is normal for patient able to read the light. Another thing that I actually forgot about that, so we have to dim the light when we ask the patient to look at that by closing the eye. So now we'll do the peripheral confrontation test. In that, we'll ask the patient to tell us when they can able to see my finger coming towards the patient. Okay, so I'm try to look at here and tell me when you're able to see the finger.
Yeah.
Okay, one more time.
There.
Perfect. So the taste is normal. The peripheral confrontation taste is normal, where patient able to see clearly. The peripheral vision is normal. So now we'll ask the patient, we'll check patient pupil by asking patient to look at the near object and the far object. So we'll ask the patient to look at the far first and then look at the near object here. Same thing again, can you look at far? Can you look at this? So while seeing that, we can see the patient pupils is getting constricted when they look at the near object and get dilated when they look at far. And we'll ask the patient to follow this pen light towards the bridge of the nose to look at to find out a body patient has any nystagmus or not. Can you follow this one? So you have to follow this when I come towards your nose, okay? Perfect. Patient doesn't have any nystagmus. Patient both eyes were following towards the pen light. So now we're done with the house. We're gonna do the fundoscopy examination. I'm gonna take my ophthalmoscope. So the whole thing, where the reason we do this to find out is there any abnormality in the patient eye. So while using the ophthalmoscope, we'll use the patient right eyes to my right eyes. Okay. Look at my nose. I'm going to start from outside. My eyes is here, and I can see the ray reflex. Perfect. All right, and I'm always trying to use my eye so I do not accidentally bump. So I use my 3 finger to brace that. Okay, I can see the red reflex. I can see the retina in the back. Okay, can you? Okay, good, perfect, and good. The fundus, I can see the disc is 1/3 in diameter. It's normal. There is no abnormality. I don't see any hemorrhage, anything, and patient pupil and the lens is clear. Sorry for the light. We'll use the same thing, looking in the other eye by using my left eye to patient left eye, and I'm going to tell the patient to look at my shoulder so I can able to concentrate here. The same thing, we're going to put the 3 finger in the front when I go close to the patient. Perfect. I can see the red reflex. The disc is, I can see the back side of the eye, the disc, and it's 1/3. There is no hemorrhage. I can see the artery and optic nerve. So ophthalmic examination is done here. We're gonna do our 3 cranial nerves. We're gonna check by asking patient to follow the finger. Number 3 is oculomotor. Number 4 is the trochlear, and number 6 is the abducer. While doing the 6 cardinal gauge. So I want you to follow my finger. Okay. Right in the middle. Now we go other side, up, back, lower, up, right in the middle. Patient moves eye in all 6 directions, which shows that our cranial nerve 3, 4, and 6 are intact. Now we'll move on to patient ear examination. So patient ear examination, we'll start with the inspection. We'll make sure that ear is formed good, it's symmetrical to the face, there is no drainage, no cut, or there is no other abnormalities. And before we start our other test for the ear, I will do the tuck test and hold the patient pinna and pull and ask the patient if that hurts. Does it hurt?
No.
No. And patient say it doesn't hurt, so that means we can perform our ear examination further. And to do the ear examination, we'll check the patient cranial nerve 8, which is vestibular cochlear now by asking patient whisper test. So I'm going to close the patient one ear and ask the patient to repeat what I just say. Apple.
Apple.
Okay, patient able to say that. Now we're going to do it here. Baseball.
Baseball.
Baseball. Patient able to say that. So the cranial nerve 8, vestibular cochlear is intact. Patient doesn't have any hearing loss. So now we use our tuning fork to do the Weber and Rene test. So first we'll do the Weber test by uh, hitting the tuning fork and putting on the patient forehead. Can you able to hear one side or both side?
Both sides.
Both side. That means Weber test is normal. Patient able to hear in the both side. Now we'll do the Rene test by using the things behind the patient ear on the mastoid bone and ask the patient to tell us when they stop hearing from the at the back of the ear.
No.
Can you still hear?
Yep.
Good. So that is normal. Now we'll do the same thing in other ear.
No.
Can you still hear?
No.
Perfect. Now we'll do the take the otoscope and examine a patient ear. Alright, we're gonna look at the patient ear with our otoscope, and same thing we're gonna follow uh, our 3-finger braces to prevent any kind of accident to the patient. So for the adult, we use the ear down and up. Oh, sorry, for back and up for the adult, and for the pediatric, we'll use down and back. So same thing we're gonna do. I'm gonna use this hand and my 3 fingers to brace backward and up, and I'm gonna look at patient ear. Okay, I can see patient ear canal is clear. I can see tympanic membrane, which is white and pearly gray. There is no open cut of wound there, and the cone of light, and the left ear is at 7 o'clock. The same thing we continue our ear examination on the right ear. So I'm going to use this hand. I'm going to put my 3 finger to brace that. Everybody use differently, so use this way. Turn on the things, and same thing back and up, so I can see the ear canal clearly. Ear canal is clear. I can see tympanic membrane, which is white pearly gray color, and the cone of light is at 5 p.m. and I don't see any kind of wound, open cut, or any abnormality or the bleeding. So here we complete our ear examination. Now we'll move on to nose examination. So we'll again inspect the patient, look at the patient. Nose is symmetrical, there is no open cut or wound, and we'll ask the patient to close the one nostril and take a deep breath in and out. Okay, and same thing we'll do continue with the other one. So this will tell us the patient can able to breathe his own. And to check the patient olfactory nerve, which is cranial nerve 1, by asking patient to close the eye and so make them to smell something pleasant so they can tell us what it is. Um, can you smell what is that?
Chocolate.
It is chocolate. That's right. So the olfactory nerve is intact. Patient able to smell and tell us clearly. Now we'll move on to nasal examination. We're going to look at the patient nose inside, and we want to make sure that there is uh, no deviated septal or any bleeding or any polyps or anything. So let's do that. Okay. Okay, I can see that. So we'll use our other hand, look at the patient nose, and I'm going to look at here. Patient nose is clear. There is no deviated nasal septal. I don't see any polyps. Uh, no bleeding or no cut or wound in the left nostril. Same thing, we continue in the right nostril. Same thing, I'm going to have my 3-finger front so I don't actually hurt the patient. Look at inside. There is no DNS. There is a pink and no bleeding. The nasal mucosa is clean and pink. No polyps. Nasal exam is normal. So after the nasal examination, so we already completed the head, ear, eye, and the nose. Now we'll move on to the face and the neck examination. So when look at the patient face is symmetrical. I don't see any kind of abnormality there, no cut, and there is no indented, and it looks good. So now we'll check the patient cranial nerve 7, which is a facial nerve. Asking patient to give a good smile. Can you smile? Good. Can you puff your cheek? Good. And can you make a frowny face? Good. So cranial nerve 7 is intact. And while doing that, we can even check the cranial nerve 5, which is a trigeminal nerve. While asking patient to take a bite, can you chew? Yes. So look at patient intact, and I'm going to ask the patient to go against my hand resistant to open the mouth. Can you open the mouth? Ah, perfect. Patient can able to do that. So trigeminal nerves 5 is intact. So while we're doing that, we can even check the patient temporal artery and the pulsation, which is I can hear is a 2 plus, and we can check the patient temporal sinus. Does he hurt? No. And we can do the maxillary sinus. Yeah, does he hurt? No. So the both temporal and maxillary sinus are normal. There is no pain, no tenderness there. And now we can check the patient facial structure, the mouth. We look at the patient lips is well formed. There is no drooping of the lips, and there is no cut or a wound there. While using our pen light, we'll ask the patient to open the mouth so I can look at the patient mouth. Perfect. I can see the mucosa is pink, mouth is clean, and there is no open cut or wound. Teeth are formed. There is no broken teeth or any kind of crown inside thing. Okay, we can use the gloves and still look at the buccal mucosa for any kind of a swelling or tenderness. Do you have any pain or anything in your mouth? No. So we can use the tongue depression to check the patient soft and hard palate, and check for cranial nerve 9, 10, and 12 at the same time. So I'm going to use the tongue depression and ask patient to say ah. Can you say ah? So while patients say ah, I can see the uvula is right in the middle, and it's when patients say ah, it's coming upward, which is normal. And while doing that, we can even check patient gag reflex. It's a gag. Patient is going to gag. Okay. Yeah, gag reflex is intact too. Good. So so patient already his cranial nerve 9, 10, and 12 is intact, while checking the patient, asking to open the mouth. Can you able to swallow? Good. Can you able to swallow? Good. Okay, so that is intact. Uh, there is another way we can check patient cranial nerve 9, 11, and 12 by asking patient to show the tongue. Can you show your tongue? Perfect. So patient able to do that means the nerves are intact. So now we check patient lymph node. We'll start with the auricle, which is right in front of the ear. Using your hands, 3 finger with the pair, we'll go to circular motion to check for the any kind of auricle lymph node, which is not palpable. We can do the posterior auricle lymph node, which is right behind the ear, which is not palpable either too. Now we go to mandible, which is right underneath the mandible bone, which is not palpable either. We can do the tonsillar, which is not palpable either, and submental, which is right under the chin bone, which is not palpable either. And now we can go to anterior cervical, which is right at the cervical side, and which is not palpable, which is normal. And now we go to posterior cervical, which is right here, which is not palpable. And at the same time, we can look at the occipital, right behind the neck, which is not palpable either. And while we doing that, we can check the anterior clavicle node, which is right at the clavicle, and we can do the inferior, which is right here, which is normal too. So I could not able to palpate any kind of lymph node, which is normal. We can only palpate lymph node when patient has any kind of infection or any disease condition going on. So we already completed our head, ear, nose, eye, face examination, and there is one more nerve, is a cranial nerve 11, which is an accessory nerve. We're going to check that by asking patient to shrug the shoulder up. Yes, so patient able to do that, which is normal. And while we're doing that, we can check the patient trachea and thyroid gland too. So can you look it up, sir? Yeah, and I'm gonna, the trachea is right form in the middle. It's straight. I don't see any kind of deformity here. Can you able to swallow? Yeah, patient able to swallow. I can able to feel the cartilage here. And now I'm going to check the patient thyroid. That goes behind the patient. Normally, for normal people, we can look at it. We can't palpate the thyroid. So it's smooth. I don't feel any kind of bulging or swelling or anything. Patient doesn't have any pain. Do you have any pain, sir? No pain. So we're done. And while doing the neck examination, we can ask the patient to do the range of motion little exercise while asking patient to. Can you look it up, sir? Can you look it down? Can you look at your side? Can you look at that side? That shows the patient has a good range of motion of the neck and there is no deformity or pain. So we completed our HEET assessment examination, and we're gonna do our 12 cranial nerves also. Same thing with the first one was the olfactory nerve, which did with the smell. Second one, we did the optic nerve by asking patient the 6 cardinal sign. Third one was the trochlear by asking patient to look at the eyelids by closing the eyes. Number 4 was trochlear things, which is also we using the cardinal sign. Number 5 was a trigeminal by asking patient to chew. Number six was the abducer, which was asking patient to look at outside and inside the eye. Number 7 was facial by asking patient to smile and from the cheek. Number 8 was abducer, vestibular coca, which is the ear. We asking patient the whisper test. We'll did the number 9, which is a glossopharyngeal, by asking patient to show his tongue. Number 10 was vagus, which also was asking patient to show the tongue and the gag reflex. Number 11 was the accessory cranial nerve, which asking patient to slug the shoulder. And number 12 was the hypoglossal cranial nerve, which was asking patient to swallow and show the tongue. So we completed our 12 cranial nerves also by doing the HEET assessment. Thank you so much. Thank you.